Your PSA came back higher than last year, maybe 4.2, maybe 6.8. And the word your doctor used at the end of that call has been echoing in your head ever since. Here's what no one told you at that appointment. Research shows up to 87% of men over 60 see a temporary PSA spike from something they did in the 48 hours before the blood draw. Something completely innocent. Something almost no doctor mentions because they don't have time or don't want to ask. By the end of this video, you'll know exactly what it is, how long it actually lasts, and how to make sure your next test measures your real prostate, not a moment in time. PSA, prostate-specific antigen, is a protein your prostate makes constantly. The test measures how much of it has leaked into your bloodstream. That's the whole test. And the number it produces depends not just on the health of your prostate, but on what your prostate was doing in the hours before the needle went in. In the next 9 minutes, you'll get the mechanism, the clearance window, the 7 factors that can throw off your number, and the 3 questions to ask before you ever agree to a biopsy. Information your urologist would want you to have if your appointment lasted an hour instead of 7 minutes. Let's start with what's physically happening inside your body. When you release, unpartnered or solo doesn't matter, your prostate contracts. Forcefully, multiple times in a row. That's the physiological event happening inside. Here's why that matters for your test. PSA is made continuously inside your prostate. Most of it stays in the gland or flows out with seminal fluid. A small fraction leaks across into your bloodstream. That's what the lab measures. When your prostate contracts hard during release, more PSA than usual gets pushed into the blood. It's like squeezing a kitchen sponge holding water. Squeeze the prostate through contraction, and more PSA leaks into the bloodstream than was there 60 seconds before. A study published in the journal Urology in 1997, Hirschman, Smith, and Catalona measured this directly. They found 87% of men experienced a measurable rise in serum PSA after release. The average rise was 41% measured 1 hour later. Some men saw their PSA nearly double. This isn't a malfunction. This is normal prostate physiology. It's like checking your temperature 5 minutes after drinking hot coffee. The thermometer isn't broken, it just caught you at the wrong moment. Your prostate isn't broken either, your test just caught it in the middle of doing exactly what prostates do. So how long does this effect actually last? Because the answer changes everything about how you should prepare for a PSA draw. At 1 hour after release, PSA is elevated by roughly 41% on average. At 12 hours, about half the spike has cleared. At 24 hours, most men are within 10% of their true baseline. And at 48 hours, PSA has returned to baseline for nearly all men. That's why most clinical labs and several major urology associations recommend abstaining for 48 hours before any PSA test. The 48-hour window is the gold standard. But here's the problem. Almost no patient is ever told this. You walk in, they draw the blood, the result comes back. And if your number is elevated, the next conversation jumps straight to repeat testing, imaging, or biopsy. Nobody asked, when was your last release? Because it's awkward. Because the appointment is short? Because most doctors weren't trained to ask. Now, for men over 60, this becomes more important. Here's why. As the prostate naturally enlarges with age, a condition called benign prostatic hyperplasia, or BPH, benign, prostatic hyperplasia, there's simply more glandular tissue producing PSA. When that larger prostate contracts, more PSA leaks into the blood, and it takes longer to clear out. Research consistently shows men over 60 with mild BPH may see PSA spikes that last closer to 72 hours, not 48. So here's the rule that matters for you. If you're over 60, and especially if you have any BPH symptoms like waking at night to urinate or a weaker stream, use 72 hours as your number, not 48. When in doubt, ask your urologist which window applies to you specifically. The extra day costs you nothing. The inflated PSA could cost you a biopsy you didn't need. Before we move to the 7 other factors, there's one question worth answering briefly, because some men hear about the 48-hour rule and start to wonder, should I just stop releasing altogether? Wouldn't that protect my numbers? Here's the short version. In the short term, release temporarily raises PSA. But in the long term, regular release is associated with a lower risk of prostate cancer. A Harvard study published in European Urology in 2016, following over 31,900 men, found that those with the highest release frequency had a 22% lower lifetime risk of prostate cancer. So the answer isn't to stop. The answer is to time your release pattern around your testing, not the other way around. We have a separate video that goes deep on optimal frequency for men over 60. Link in the description. For this video, the focus stays on test accuracy, because that's a completely different question. So we've covered why your prostate spikes PSA when you release, how long it takes to clear, and why men over 60 are hit harder. One quick question for you down in the comments. If you've ever had a PSA test come back high, how many hours before that blood draw was your last release? Less than 12? Less than 24? Less than 48? Or were you told nothing at all about timing? Drop the number, because it helps every other man reading this know he's not alone. And if this video is giving you something your 7-minute appointment couldn't, give it a hype. 3 free per week, and it helps other men over 60 find this exact conversation. Now on the 7 things besides release that can throw off your PSA. The 4th one is the one most men never even consider. 7 factors that can spike your PSA, independent of cancer. Memorize this list. Bring it to your next appointment. 1. Recent cycling or horseback riding. Pressure on the perineum compresses the prostate and can elevate PSA for up to a week. If you cycled for an hour the day before your test, your result may be inflated. 2. A recent digital rectal exam. If your doctor performed a DRE and the blood draw happened afterward, PSA can stay elevated for up to a week. Always ask for the blood draw to happen before any physical exam. 3. An active urinary tract infection or prostatitis. Prostatitis. Or inflammation dramatically raises PSA. If you've had any recent burning, urgency, or pelvic discomfort, mention it before the test. 4. BPH itself, independent of cancer. This is the one most men never consider. A larger prostate simply makes more PSA, period. Here's why that matters. A man with severe BPH and 0 cancer can have a true baseline PSA of 6 or 7. Another man, same age with a small prostate and early-stage cancer, might also have a PSA of 6 or 7. The number alone tells you almost nothing without knowing your prostate size. This is why my PSA is 7 means nothing without context. Always ask your urologist what your prostate volume is. That one piece of information changes how every PSA number should be interpreted. 5. Certain medications. 5-alpha reductase inhibitors, drugs like finasteride, fin-aster-id, and dutasteride, actually lower PSA by about half. If you recently started or stopped one of these, your numbers will shift even without any prostate change. 6. A recent catheter or any prostate procedure. Any instrumentation of the urethra or prostate raises PSA for days, sometimes weeks. 7. The lab itself. Different labs use slightly different assays. 2 labs can give different numbers from the same blood sample. If you change labs between tests, the comparison may not be apples to apples. Each of those 7 is a mistake you can avoid if you know to look for it. Here's exactly how, starting before your next blood draw. Your action plan. 2 weeks before your next test, note any cycling, infections, or procedures. Write them down, bring the list. 48 to 72 hours before. No release, no cycling. No long horseback rides. No prostate stimulation of any kind. The morning of the test, ask for the blood draw to happen before any physical exam. Mention any infection symptoms, even mild ones. Here's the moment most men never have. Walking into a urology appointment with better questions, not just better blood pressure. If your PSA still comes back high, ask your urologist these 3 questions, word for word. Was anything in the 48 hours before this test possibly affecting it? Can we repeat the test in 2 weeks with strict prep? No release, no cycling, no DRE first? Should I consider a PSE test Or a 4K score to add specificity before we move to biopsy? Here's the number every man over 60 should know. Roughly 75% of men with an elevated PSA who proceed to biopsy do not have cancer. 3 out of 4. That isn't a statistic to ignore. That's a statistic to bring with you into the conversation. If you remember nothing else from this video, remember this one sentence. The test isn't broken. The timing is. A high PSA is not a sentence. It's a signal. One that deserves better information before it leads to a needle. Most men over 60 walk into their next PSA appointment knowing none of what we just covered. You won't be one of them. You're not the patient with bad news. You're the man with better questions. Hype this video if it gave you something your 7-minute appointment couldn't. And in the next video, we go deep on the question this one only touched. How often should men over 60 actually release for both prostate accuracy and long-term protection? The answer surprises most men, and the research is clearer than you'd think. That video is linked on screen now.